again, everyone, Mark Macomb, Macomb County Executive, here at the Health Department right now with Bill Rodella. Bill is the guy who runs our Health Department here, Director of the Health Department, and has been doing it for some time. The guy who's really been helping us through this pandemic and the crisis that we've had. His staff has done an incredible job here. There's so many facets to what we've got going on and have been dealing with throughout this entire COVID crisis since it hit us March 13th. So first off, credit to Bill and his staff who've done a phenomenal job of especially getting information to the public, giving people an opportunity for testing sites, and the volume of calls that we get on a regular basis. But understand this, it's not just COVID. There are other issues that continue to happen in the community. They're still having to distribute for normal vaccines for other flus and everything else that go on with the health department. So nothing is stopped, nothing is shut down since the beginning of this. It continues on. So Bill, credit to you and your staff for what you've been able to do through this crisis. And kind of the reason why we're here today and want to talk about the update is we finally got one of the freezers, one of 5 total freezers that we're going to be getting here, where they're going to be storing the vaccine when it comes. And this is something I think is kind of like at least enlightening for people to realize. There's light at the end of the tunnel, meaning there's going to be a vaccine, which I think everybody agrees that's probably the number one thing that's really going to help us through this pandemic. We can talk about social distancing, washing our hands, making sure we're wearing the mask and all that. Those things can help mitigate it, but there's no question about it. The only real way of getting rid of this is through the vaccine, and we're finally seeing that now that we have these freezers on hand. We're getting there. It's just when the vaccines come, we know we are prepared by having storage. So, Bill, kind of walk us through that process. Where are we at?
Mark, we're excited that we're starting to visualize this now because we've been hearing about things in the media and the newspaper. But vaccines is one of the best accomplishments in the last 100 years in public health. We know vaccines reduce infectious disease, and that's why they work. And so I've got to give credit to all of the scientists that have labored and put a lot of time into producing these vaccines in such a short period of time. And now we're at a point when, we're thinking that the first vaccine that we're going to get is going to be arriving sometime in December. And we want to be prepared to provide that vaccine, and part of that preparation is knowing how to store and handle it. So the storage equipment is starting to come. This is the first of 5 ultra-cold freezers that we're going to have for the Pfizer vaccine product for COVID-19. It's got to be stored at minus 80 degrees Celsius, right around that temperature, and so this will be 1 unit, and we're going to get 4 more, and hopefully in sometime mid-December, we should be able to be providing it to the first group of people that really needs it, and that's our healthcare workers. And so that's the first group of individuals, because they are working with people in the hospitals, in healthcare settings, that we want to put that line of defense up there. And then there'll be another phased-in approach that the Centers for Disease Control and Prevention have established that we'll be following here in Macomb County.
Yeah, we're going to get that word out. So the public's going to get plenty of information as to when we get the vaccine, but we don't need a flood of people knocking on the doors of health departments throughout the entire, county or throughout the entire region saying, can I get mine? I want mine first. And I think there's going to be more of an interest in getting this vaccine. I say it for this reason, knowing that it has a pretty high rate of success for what I'm hearing, which is actually higher than most vaccines that are out there, but also knowing that probably the first distribution are going to go to the healthcare workers that are on the front line, their willingness to take it, and these are the folks that help keep us safe and keep us healthy, especially if we're sick. If they're willing to take it and there's great success with that, I have a feeling you're going to see a lot of people saying, I really want to get this, so when is it my turn? And with that being said, you'll know when it's your turn when the information comes out. We're going to follow all the guidelines from the, if you will, the CDC guidelines, the national guidelines, as well as what comes to us from the state. And we'll deploy it and make that available to the public, as is decided by those folks that understand how to deal with it and what we have available at the time.
I mean, we don't know how much we're going to get and how that's going to be flowing into Macomb County over the next few months, but we know that by the trials that have been done, the ability for these vaccines to prevent the disease, that's what's important. That's why you want to get vaccines, to prevent the disease or reduce the burden of a disease. And that's why we're always promoting the flu shot, which we are still promoting here in Macomb County and giving out a lot of doses, not just through the health department, but a lot of other providers and even pharmacies give out the flu shot. But that's why we have childhood vaccinations, and that's why this vaccine, and I'm really impressed with the trials so far, that they're 95 plus efficacy, they are preventing disease. There'll be a 2-dose for each of the first 2 coming out. The Pfizer vaccine, which will be the first one, is a 21-day between both doses. The Moderna one, which we do expect to be our second type of vaccine, it's not stored at the ultra cold level. That'll be a 28-day between both of the vaccines. So determining how we're going to, the logistics behind then preparing sites and partners to prepare to administer the vaccine is currently being worked on, and we're going to, like I say, we want to be prepared with a lot of this in early December. So when it's coming to us, we're ready to act and get people vaccinated.
Yeah, so rest assured, we understand that it doesn't matter which one of the vaccines that we get coming our way. There's going to be a process. We're going to get that word out. Again, as Bill had mentioned, it's going to be a 2-dose process. So, whether you're getting the one from Pfizer or the other, you're going to get the one, and you'll be notified when to come in for the second, I guess, if you will, dose. But that will be determined by the health department and the guidelines we get. So, interesting enough, we've dealt with freezers and storage capacity for different types of medication here within the health department. This is just something brand new. It's probably one of the larger units that we have, and obviously stores at a much colder, I guess, temperature than any other. As you can see, it's already at the 65 or minus 65 right now. And we can just open it up and show them real quick if you want. I'll just kind of pull this your way. So there's nothing in here, so it's not really damaging anything or causing any concern or problem. This just basically, it's all it is very similar units like this. When we get the vaccine, it gets put in here, placed in here, and stored at the frozen temperature. So then they close it up and then make sure that when it has to be redistributed, it's taken places where it needs to go in coolers. And there's a process that they understand here within the health department of how to get that to a person before they actually give them the shot.
And I think, Mark, the main thing is we know this isn't going to be readily available for the general public. That's going to take some time, and there's going to have to be tens of thousands of vaccines available. But I think what the public needs to know is that vaccines work. All the vaccine we have stored in this room here is there. It's been researched. It's been effective in preventing a lot of the diseases, the pertussis, the mumps, measles, rubella, certain types of hepatitis. We had the hepatitis outbreak a few years ago, and that was an effective vaccine. So we need to trust the science behind the vaccinations. They do work. Childhood vaccinations work, and we want people to know that this is something that, yes, is happening very quickly, but trust that it's going to work and benefit us for the long run in fighting this illness. More people get it, the better we're protected, the better herd immunity we establish in our community. So I really want to implore to the residents to get this vaccine when it's available. That's an important thing we need to do.
So let me ask you this, based upon your experience and hearing from other healthcare officials, there are people that are going to want to take it, and we know they're probably still that aren't going to be, they're skeptical, they just don't have an interest in taking it. Do you think, and it's going to be a question I got to believe people are asking right now, that it's going to be required or mandated that you take this?
Well, again, I don't think it will be required. I think certain employers may. If you work in a healthcare setting or in a hospital, you may be required to have it. You work in a nursing home, long-term care facility with vulnerable populations. There's a decision that's going to be made by that particular organization and probably say you're going to have it.
Got it.
But I think for the general public, it's going to be voluntary, just like all vaccines are. But again, as I said, the more people we get to be vaccinated, the more herd immunity, the more protection, and we're protecting those that can't get vaccine too.
Right.
There's a number of people that cannot get the vaccine, and that's why we have school vaccinations and require those, because there are certain children that cannot obtain certain vaccines, and we want to make sure we protect the medically fragile that cannot get those.
Yeah. Well, again, Bill, we appreciate all your efforts, the work that you've been doing here, and your staff. Incredible job. We know there's test sites throughout the county. We've been testing more than we've tested from the onset. It's amazing the number of people that are going through just our test site here on Rose Street. It's amazing the number of people that are getting tested. But we know there's still an uptick, and there's a concern. And the big concern is in hospitals. Hospital beds are at capacity. We're fortunate. Morbidity, the actual deaths are still lower than what we had in April, but it's still a big concern. So people, you need to remind yourselves to keep yourself safe, washing hands, social distance, wear the mask, and less group contact with lots of people. We do do want people to enjoy their families, enjoy the holidays, but you need to be very mindful. But rest assured, here in Macomb County, we're prepared when the vaccine gets here. We've got 1 of 5 units that we're going to be getting, and the health department, boy, they're top notch when it comes to making sure that we dispense this in an appropriate way. And you will get that information once it comes our way, so that you know exactly how to deal with this when it comes. So, Bill, again, thank you for your efforts, and we want to remind all of you once again to keep you and your family safe.